guys, welcome back to my channel Speak Your Mind, and I'm Nisha, and today we'll talk about postpartum depression. So let's begin the video. What is postpartum depression? Depression that occurs after childbirth. Your body and your mind go through so many changes during and after pregnancy and childbirth. If you feel lonely, empty, emotionless or sad, or most of the time for longer than 2 weeks during or after pregnancy, then it's time to reach out for help. Most women get the baby blues or feel sad or lonely within a few days of giving birth. For many women, the baby blues go away in 3 to 5 days. If your baby blues don't go away or you feel sad, hopeless, or empty for longer than 2 weeks, you may have postpartum depression. Postpartum depression is when these feelings don't go away after 2 weeks or make it hard for women to take care of the baby. It is relatively common but serious medical condition affecting up to 1 in 7 new mothers after birth. Postpartum depression is a serious mental illness that involves the brain and affects your behavior and physical health. Postpartum depression is a complex mix of physical, emotional, behavioral changes that happen in some women after giving birth. Having a baby is a stressful and life-changing experience, no matter how much you have looked forward to it or how much you love your child. Considering the sleep deprivation, new responsibilities, lack of time for yourself, it's no surprise that a lot of new moms feel like they are on an emotional roller coaster. It's normal to have feelings of worry or doubt, especially if you are a first time parent. However, if your feelings include extreme sadness, loneliness, severe mood swings, and frequent crying, these changes can cause symptoms of postpartum depression. It carries risk for the mother and child. Pregnancy and the period after delivery can be particularly vulnerable time for women. Signs and symptoms of postpartum depression. In the beginning, postpartum depression can look like the normal baby blues. In fact, postpartum depression and the baby blues share many symptoms, including mood swings, crying jacks, sadness, insomnia, irritability. The difference is that with postpartum depression, the symptoms are more severe. Trouble sleeping or sleeping too much, loss of energy or increased fatigue, difficult thinking, concentrating, or making decisions, lack of interest in the baby or feeling very anxious about or around the baby, feelings of being a bad mother, fear of harming the baby or oneself, feeling sad, worthless, hopeless, or guilty, changes in appetite or not eating, crying for no reason or crying excessively, withdrawing from friends and family, feeling worried, scared, or panicked, feeling restless or moody, having thoughts of hurting yourself, having trouble focusing or making decisions, and memory problems, feelings of worthlessness, shame, or inadequacy, diminished ability to think clearly, concentrate, or make decisions, severe anxiety and panic attacks. A woman experiencing postpartum depression usually have several of these symptoms, and the symptoms and their severity may change. These symptoms may cause new mothers to feel isolated, guilty, or ashamed. Postpartum depression causes and risk factors. Hormonal changes. After childbirth, women experience a big drop in estrogen and progesterone hormone levels. Thyroid levels can also drop, which leads to fatigue and depression. These rapid hormonal changes, along with the changes in blood pressure, immune system, functioning, and metabolism that new mother experience, may trigger postpartum depression. Physical change, stress. The stress of caring for a newborn can also take a toll. New mothers often sleep deprived. In addition, you may feel overwhelmed, anxious about your ability to properly care for your baby. These adjustments can be particularly difficult if you are a first time mother. Lack of sleep. When you are sleep deprived and overwhelmed, you may have trouble handling even minor problems. Anxiety. You may be anxious about your ability to care for newborn. Self-image. You may feel less attractive, struggle with your sense of identity, or feel that you have lost control over your life. Any of these issues can contribute to postpartum depression. Other feelings may contribute to postpartum depression. Many new mothers say they feel a medical history of depression prior to becoming pregnant or during pregnancy. Age at the time of pregnancy. The younger you are, the higher the chances. Limited social support, doubts about their ability to be a good mother, stress from changes routine. Children, the more you have, the more likely you are to be depressed in later pregnancy. Family history of mood disorders or anxiety. Going through an extremely stressful event like a job loss or health crisis. Having twins or triplets or child with special needs or health problems. Living alone or marital conflict, feeling tired after labor and delivery, overwhelmed with a new baby, and unrealistic need to be perfect mother. These feelings are common among new mothers, but postpartum depression is a serious health condition and can be cured. Management and treatment of postpartum depression. Postpartum depression is treated differently depending on the type and severity of your symptoms. Treatment option include anti-anxiety or antidepressant medicines, psychotherapy like talk therapy or cognitive behavioral therapy, self-care, lifestyle changes and supportive environment or combination of these. Medications. There are different type of medicines for postpartum depression which can help manage symptoms and improve the mood. Antidepressants can help relieve symptoms of depression and some can be taken while you are breastfeeding. Antidepressants help balance the chemicals in your brain that affect your mood. Self-care tips. During and after pregnancy, a person can take some steps to help prevent or manage postpartum depression. Strategies include having a healthy diet, getting regular exercise, eating small meals regularly to maintain blood sugar levels, getting at least 7 to 8 hours of sleep each night, speaking openly to loved ones about feelings and concerns, keeping in touch with friends, family, especially if you parenting alone, resting. In people with postpartum depression, studies shows that the CBT along medications reduces symptoms more effectively than medications or other therapies alone. Its aim is to find new ways to approach and interpret situations and develop more positive ways of thinking. CBT involves learning and using techniques and strategies that enable you to change your thinking patterns, use problem solving skills to cope with difficult situations, and develop greater confidence in your own abilities. During therapy, you talk to therapists, psychologists, or social worker to learn strategies to change how depression makes you feel, think, and act. These treatments can be used alone or together. Having depression can affect your baby. Getting treatment is important for you and your baby. Taking medicines for depression or ongoing therapy does not make you bad mother or failure. Getting help is a sign of strength. Untreated postpartum depression is dangerous and affects you, your baby, and those who love you. Postpartum depression is extremely common. You're not the only person who feels this way, and it doesn't mean you are a bad person or you are a bad mom. Postpartum doesn't mean you are a bad parent, and it's not your fault. If you notice symptoms of postpartum depression, you need to tell your healthcare professional and seek medical treatment as soon as possible to start treatment to feel better. So this is it for today, and I'll see you in my next video. Till then, bye bye and take care. And before going, just make sure you like, share and subscribe my channel. And what do you think about this video? Just comment in a comment box, and I'll see you in my next video.